how does home visits, and I'm going to ask both of you, and nurse care management reduce the need for other emergency departments and maybe hospital visits? Dr. Fialkow?
So it speaks to, again, the spectrum of care of a patient, what's called care management, putting people in these programs based on their needs, and having a coordinating team or even a coordinator who's responsible for that person. So for example, when you have home visits, the idea is that patients can't get to the doctor's office when they're not feeling well. If they can't get to the pharmacy to fill their prescriptions, they'll become sicker, eventually call an ambulance, and wind up in the hospital, which is of course the most expensive place for people to get their care, or sick and potentially die. So the idea of going to where the patient is, as Steve said earlier, is what's most important. So we look at what the needs is of the patient in a particular program, and we want to get to them where they are. So for example, if we have a care management program for what's called complex disease, which we do, we can give you an example where we had a patient who was in the hospital every 3 weeks, an older lady, she was on 14 medications, couldn't really get out of the house, and every 3 weeks she was winding up by an ambulance in the hospital for several days. And we identified her. She was assigned a care coordinator who is a nurse who's assigned to her case. She can call the nurse anytime. The nurse would constantly call her. The nurse would help get medications delivered, help her make and get to her doctor appointments, and we were able to decrease her emergency room utilization and of course improve her health significantly with those types of examples and those types of models. That's on the complex end, and then going back to children or other needs of populations, it's again going back to that, find them where they are, give them the needs, fill the needs that they have, and you'll make them healthier and utilize health resources like emergency rooms much less.